US President-elect Donald Trump has nominated Robert F. Kennedy Jr. to head the United States Federal Health Agency. RFK Jr. ran as an independent presidential candidate before ending his bid and joining the Trump campaign. Co-host of Planet America, John Barron, is with us to unpack it all. John, good morning. Let's start with RFK Jr. What does this mean?
It means, in the words of President-elect Trump, that Kennedy can go wild with America's health system. Robert F. Kennedy Jr. is described, Dan, by many as an anti-vaxxer. He denies he's an anti-vaxxer. He is a vaccine sceptic. He says no vaccines are safe and effective being kind of the legalese by which the Health and Human Services Department approves vaccines. He has said when he was running for president himself that he would like an 8-year pause on the development of new vaccines. He would like the focus to go from infectious diseases to chronic diseases. He points to environmental pollutants, chemicals that are in food, other things that he believes may be linked to a range of health conditions. He has falsely linked vaccines and other chemicals to autism. There is no research at all that says that is true. There was some widely discredited fake science in the late 1990s that once drew that link, and it's become basically a conspiracy theory ever since. So Kennedy has some way out of the mainstream ideas. He's a former environmental lawyer, long-time heroin addict, as well as being the son of Senator Robert Kennedy, who was killed running for the presidency himself in 1968. So he has a checkered career and a fixation on vaccines. This role will give him the power to stop the approval of any new vaccines that are developed by the likes of Pfizer or Moderna. So heaven help us if there is another pandemic while Robert F. Kennedy is in charge.
And are there any systems in place at the moment that would get around if he was to say that, to say, no, we are not going to be contributing or doing any research and development on further vaccines? Is the system robust enough to get around that, or no?
It's robust enough that the private sector can conduct that research, but they cannot put those vaccines into the marketplace, provide them for consumers without regulatory approval, and that has to come from Kennedy and Trump. So this is the major concern. It is also a concern that just by the very nature of Kennedy's scepticism, and many would say scepticism is good, but not if it's not based in medical science. Kennedy has in the past been blamed for literally dozens of deaths in, for example, American Samoa, when he went there 5 years ago and spread misinformation about the safety and efficacy of the measles, mumps and rubella vaccine, the MMR vaccine. After his visit to that American territory, there was a drop in vaccination rates. The next year, there was an epidemic of measles. People died as a result. So Robert Kennedy is seen very much as a fringe figure who's been brought into the mainstream because he supported Donald Trump. And Donald Trump has basically made this deal, and he said as much publicly, as long as Kennedy doesn't campaign against fossil fuels, because Kennedy, being a former environmental lawyer, is also concerned about carbon pollution. But he says, as long as you let me drill and burn, then you can do what you like when it comes to the public health sector. Kennedy has promised what he's referring to as MAHA, Make America Healthy Again. And his defenders will say, well, there are concerns that there are additives in some American foods that could be contributing to obesity, could be contributing to heart disease. He might do some good, but anything he might do to reduce the amount of forever chemicals in the food chain or pesticides that have been banned in other countries would be more than overwhelmed by the sheer folly of banning proven, safe and effective vaccines, which is the very real danger now.